We are at OnePeak Medical's brand new Lake Oswego location, and I am with the founder, Dr. Nisha Jackson. Dr. Jackson, thanks so much for having us at your beautiful new clinic.
Thank you.
You have several locations throughout the region.
Yep, we have 13 now. 13 medical clinics in the state of Oregon.
And what all do you treat here?
Yeah, well, we are a primary care clinic, so we do primary care first, but we do it from a functional medicine standpoint, which means we're looking at the problems underneath the symptoms that people come in with. So we can look at those symptoms, identify those symptoms, and treat them so that we can use less medications and people can stay healthier longer.
Such a variety of services here. Tell us about a few of them.
Yeah. So when we have patients come in for primary care, or maybe they're coming in for a symptom problem like insomnia, depression, body pain, inflammation, weight gain, we want to do some deep testing. We want to figure out what's going on in their whole body. We don't like to treat symptoms based on just symptom profile or just testing. We don't want a patient to come in that has depression and say, okay, you have depression, take this test. If you score high, I give you an antidepressant. We want to say, why are you depressed? You've never had depression before. We want to figure out what's going on underneath that. So our testing is a little bit more elaborate. We might be treating autoimmune disorders. We might be treating certain problems that people come in with. But first and foremost, we want to get the patient centered, and we want to work with the whole person, not just the symptom and not just the medication.
So there is a big difference between functional medicine and conventional medicine, but when people hear functional, they sometimes think, oh, a naturopath,
Right.
but that's not the case.
Right, no, our clinic's not a naturopathic clinic, but we just have more tools to get people healthy. So we do the same thing as a traditional primary care clinic, but we just have more tools for testing or more tools for treating. We want to ask, why do you have it? So we want to get to the root of the problem. Traditional or conventional medicine usually focuses on what is the problem and how do we treat it, rather than why do you have the problem and what's underneath it. Those are the main differences between traditional or conventional medicine and what we call functional medicine.
Dr. Nisha Jackson, I learned so much. Thank you.
Thank you.
To learn more about OnePeak Medical's personalized prevention-focused primary care, visit onepeakmedical.com.